you guys, first of all, I understand it's the Public Health Club. And I also realize as a graduate from Cal Poly that although I was a nutrition student, I belonged to other clubs that had nothing to do with nutrition. So I would like to hear from you guys. What are your majors at Poly?
I can go first. I'm a public health major with a concentration in worksite and university health promotion and a minor in psych.
Thank you, Nadia.
I'm also a public health major, concentrating in community and public health.
All right. Thank you, Gianna.
I'm also a public health major, majoring in community and public health, which I guess shouldn't be a surprise, but I also wanted to read some of the majors that have been put in the chat, which include aerospace engineering, which is pretty cool, environmental management, awesome, public health, fun, biology, aerospace engineering, animal science, and civil engineering.
All right. Thank you. Thank you, everyone. I appreciate that. And then also, I'd also like to get a feel for how many of you know a reasonable amount of information about the WIC program. Okay. All right, great. That helps me know how deep to go into. So a little bit about myself, and also you don't have to wait until the end to ask a question. I'm not a big fan of hearing myself talk all the time, so feel free to unmute yourself and just interject your question or a comment or anything. I like to keep it really informal. And yeah, so feel free. So a little bit about myself. So I graduated from Cal Poly, and I was a nutritional science major. And I took kind of the roundabout way to get to where I am today. I am a local and I grew up here, and I don't like to use this phrase, but back in the day, you had a few choices, not like a lot of students who, my kids especially, they applied to different colleges and you toured them and you did that whole process. I was actually offered growing up here, either go to Cuesta or go to Cal Poly. And at the time I had a stepfather who was a history professor for many years at Poly, and my mom worked at Poly also in the business department. So it's a natural progression for me to go to Poly. I didn't know what I wanted to do. I had no idea. So I went into political science. And then after a year or so, I decided that I wanted to go to the physical therapy route. So I went into, at the time, the major was called recreation education. And so I went into that major, and then I did everything I was supposed to do to get into the physical therapy program at Fresno State. So the first 3 years, that's kind of where I was at. And then I transferred to Fresno State and I lasted 6 months. Didn't like it, didn't like the program. So at that point in time, and I'm spending my own money, I'm taking out student loans, and I'm on my own. And so I took a year off and I worked, and I cleared my brain and I just worked. And it was the best thing for me. I think I worked for an insurance company and I was the reception. So took a year off, and then someone one day recommended that I go to the career counselor at Cal Poly, and I did. And I took this test that said, where's my, interests lie? And so I lied towards nutrition and health, kind of like all of us here today on the call. So I applied and went back to Poly, and from another 3 years, I worked full time and I got my degree in nutritional science. And that's kind of the long story. It took me a while to get through college, and that's okay. Looking back, it was fine. I got where I needed to be. And so I graduated in December ceremonies, went through ceremonies in December. And then 3 weeks later, I went to my dietetic internship at USC Medical Center in LA. And so it was a quick rush, and I stayed in LA for a year. And, you know, being from San Luis and then going to LA for a year, that's all it took for me to know that I wanted to come back to San Luis. And so I had met my husband already. And so I came back to San Luis, and I've worked primarily San Luis and Santa Barbara counties. And so I came back from my internship after, and my internship down in LA was fantastic. I was everywhere. I was the medical center, the base was in East LA, and we just went all over. We went to South Central LA. We went to, I did clinical, you know, the best rotation, and it sounds kind of weird, the best rotation I ever had was at the medical center in the burn unit. You really saw the effects of nutrition on those who suffered burns, and it was absolutely amazing. Unfortunately, coming back to San Luis, we're not large enough to have something of that nature. So what I did was I worked for the first 5 years as a registered dietitian, inpatient care. I worked at right now on Johnson Avenue. The health center, the main hub is the admin is in the old General Hospital. And that's where I used to work. I used to work at Marion Medical Center in Santa Maria. I worked at French Hospital. And so I did a lot of inpatient care. I did outpatient care. I did renal. I did diabetes, and I did weight loss. And then I was also assistant food director. And then all of a sudden, after 5 years, I had kind of done all I could do in the clinical realm. And I applied for a job down in Santa Barbara County in Santa Maria for a public health nutritionist. And so in 1995, I started as a public health nutritionist for Santa Barbara County. And the WIC program down there was also under the umbrella of public health. And so one of the questions was for me to talk about is, when was my first foray into public health? And that was it. And I have not looked back. I have worked for public health, for WIC, under public health for 27 years, and I have absolutely loved it. Those of us who are in public health, and you may know this already, you know it's a fit, because it's just working with the community and making the quality of their health better in the community in which you live. And typically, you know, I didn't know at that time that I would love it so much. So I recommend for anybody to get any experience you can in the public health realm. But some people already know. They know if they love it, and I absolutely loved it. And so I worked for the WIC program for Santa Barbara County for 21 years. And then in 2016, I came to San Luis County. When I was at Santa Barbara County, it was a little different. The umbrella, WIC was under the umbrella of public health. And you will notice that depending on where you work after you graduate or where you work now, the organizational chart is a little different depending on the county. And down in Santa Barbara County, we just not only did WIC, we also we had other programs such as CHDP, which is for children, or CPSP, where we did services for pregnant women. And we also, at the time, we had myself and another person, we would go to Head Start clinics. So there was a lot of things that we did under the umbrella of WIC for public health down in Santa Barbara County. I did everything from being a public health nutritionist and then I just slowly went to a site supervisor job. And then I went to a job that was nutrition education coordinator, which was also similar to what you would see assistant director of WIC. But after 21 years, you know, I had done the commute for a long time from San Luis, and I was tired. You know, you get to a point where even though people would say, oh, you get to see the beautiful ocean, you know, going from San Luis to Santa Maria and Santa Barbara. And that is true. But after 21 years, I was a little tired. So I applied for a job here at San Luis County. And I wasn't WIC director at the time. I was a public health nutritionist, and I loved it as well. Public health is just a great fit for me. And then about a year ago, our director, she retired and I applied. And so I've been the WIC director for over a year. And that's kind of where I've been since I graduated from college. Prior to that, I did every job under the sun: bookkeeper, cleaned houses, did garden work. I did everything. So I think experience really played a part in where I am today. And I will say, it's more commonplace now for undergrads to go ahead and get their master's and then maybe get their PhD. It wasn't so much then. And I will say where I am today had a lot to do with not having the higher degrees, but having the experience. And it's a different climate nowadays. And so I think getting a master's is probably more commonplace. Going back to the umbrella, how it works for public health in San Luis County, and I'm not an expert in the other departments, but the overall term for us is health agency. And then under the health agency, we have public health, and then we have behavioral health, which houses mental health and drug and alcohol. And then we also have, under our umbrella, we have tobacco control, we have health promotion, we have car seat programs. And so it looks different from county to county. And if you're going to apply for a public health position, know the organizational chart, know how it's set up. And it's just different from county to county. So that's kind of the beginning of where I started. I know there's a list of questions. So the question is how you got involved in public health. It's when I went to that position in 1995 down in Santa Barbara County and haven't looked back. It's been fantastic. What's my current role? Well, my current role is WIC director. My title for the county is Nutrition Services Program Manager. And what I do is I oversee the program operations of the WIC program. Here in San Luis County, I'm just working with the WIC program and then other county entities, but it's not like Santa Barbara County where we had all these other programs underneath our umbrella. My day-to-day duties, administration, budgets, gosh, there's so many, it's so hard to explain the position sometimes. Operations, budgets, staffing, hiring, training, dealing with 1,000 of emails that come to my box every day. But I would say, and then making sure that the service that we provide to our participants is no less than stellar. A little bit about our WIC program. We serve 3,800 participants per month. And I guess I should step back and talk a little bit about what WIC program is. The WIC program stands for Women, Infant, and Children Nutrition Supplemental Program, and it's been in existence since 1974. Now, the WIC program is a federal program, but how it works is the federal government gives us money, and then that gets issued to the state program, our mothership, and then those funds get divvied out to the different local agencies, of which we are one. There's 84 in California, and they're not all run underneath the county entity. Some are run at hospitals, some are at tribal organizations, some of them are run under Red Cross. And so some of them, again, are under the county umbrella, but some of them are private nonprofits. And so it's just different, but we have 84. California is the largest WIC in the nation. And we also have them at military installations. They are at, and I always forget this, they are at all 50 states nationwide, 32 Indian tribal organizations. They're in American Samoa, District of Columbia, Guam, Commonwealth of Northern Mariana Islands, Puerto Rico, and the Virgin Islands. So we're all over the place, and it's been going on since 1974. I think San Luis started theirs in 76. So I get a question a lot about, is WIC an entitlement program? And WIC is not an entitlement program. What WIC is WIC is a grant program that isn't given specific funds in the budget for the federal budget consistently. We are a grant program that gets provided funds on a yearly basis. And there's a really good distinguish. It's different because it's not something that, and I think that's something that people think that it's an entitlement program, and that, you know, it's not. And it's also a program that is just really important, because for all the time that we spend on our pregnant women and our breastfeeding women and our children and infants makes a huge of difference in the health and quality of their life. I think the quote was every $1 we spend in WIC to help our participants is a $3 to $4 cost savings in healthcare. And we service nationwide 50% of the infants that are born in the United States are on WIC. So that's huge. We for our program, just for percentage wise, 3,800 participants, 60% are children from age 1 to 5. So predominantly our program is children. We service pregnant women, postpartum women who may be breastfeeding or may not be breastfeeding, infants, and then children. We provide nutrition education, breastfeeding education. We provide referrals. Referrals are huge. One of the main things we do is when participants come in, we ask them, what do you need? Do you need information for housing? Do you need information for more food? So referrals are a large part of what we do. And I'm missing one thing. Oh, and then also the benefits. Benefits, can anyone tell me what type of foods WIC participants receive? They receive, the one thing that's different between WIC and food stamps is that we have specific foods that they're able to receive. And so they receive healthy foods through fruits and vegetables. Their protein foods are either beans or peanut butter. We provide milk, and we provide different types of milk, such as lactose-free, soy, and regular milk. And then whether the regular milk be 1%. We provide whole grains. We provide juice, and which is part of the vitamin C. And I'm missing some other foods. But it's every participant in our program has specific foods that they're eligible for. One of the great things about COVID is the fact that the federal government provided us more money for fruits and vegetables. And so before, for example, children would get per month $9 for fruits and vegetables. Now they're getting $24. And then the breastfeeding moms and the prenatal are getting close to over $34, $36 per month. And that's fantastic, because more fruits and vegetables are good for all of us. I'm going to stop right there. And would anyone like to ask a question or unmute themselves? And so, again, a lot of questions I get is, well, what have you been doing with COVID? And so the interesting thing is California from 2019 to 2020 was undergoing a major remodel for their application that we use, our computer application. And so we had started in 2019, and because we have 84 agencies, everybody was in a wave, and every wave was introduced to the new application slowly. We were wave 8, and we went on our new application and went live February of 2020. And it wasn't that much longer until COVID hit and everything closed down. And so we went remote. All the doors closed and we went remote, and we had to scramble. How were we going to do this? You know, everybody can probably remember, now it's so commonplace to do Zoom meetings and Microsoft Teams meetings, but back then, you know, no, we were all kind of scrambling. So it was just amazing how we just adapted, and we service all our participants via phone appointments. And that was a big task because there's a lot of guidelines in WIC about how you have to be present for a certain appointment. You have to show income, you have to show address. And so there was a lot of behind the scenes that the federal government had to give us permission. They had to give us waivers in order to see people in person. They had to give an official waiver for us to not have to have participants present. And so actually, to be quite honest with you, 2020 was kind of quiet. Everybody kind of got their game face on, and we started serving all our participants by phone. So looking back, when you compare 2020 to 2021, and I don't know how you guys all feel, but 2020 for WIC was a lot calmer than 2021. 2021 is where things started to open up, and we weren't quite sure what we were doing. And I think you guys felt the same way. Cal Poly, I mean, I get the emails all the time because I have a son who goes to Cal Poly. And I think, and you guys can attest to this, how many emails did you get per day? From a lot, yeah. And we got a lot as well. I mean, mask on when you test, this, this and that. So 2021, we got different guidelines, and we were going by federal guidelines, state guidelines, and county guidelines. And it got really confusing. And so 2021 was quite the year. So October came, and we finally were able to open up, and we were finally able to see our participants that came into the sites. Granted, it was nothing like it used to be. We really tempered it. We didn't want, and our participants didn't want to come in necessarily either. They were nervous. Can you imagine a new mom with a new baby? You don't want to bring that baby into anywhere. You wanted to protect that baby. And so we had guidelines that we had to follow. And so we started in October, and we started seeing some clients who wanted to come in. And then what hit? Our variants. So we opened, we closed, we opened, and we closed. So where are we now? We are with Omicron, and the numbers looking better, and Omicron kind of going bye-bye a little bit. We are now starting to see people starting to come back in. And hopefully this is a sign of normalcy for us, for all of us, for you guys and everybody. Public health has been absolutely amazing. Our leadership at Public Health for San Luis, I'm just so impressed. If you ever have a chance to meet our leadership, if you ever have a chance to meet Dr. Borenstein, go up to her and thank her. She's a phenomenal person, and everybody that she works with. It's been crazy, but it's without her leadership, I think we'd be a lot worse off. So let me see where I'm at. Feel free to chime in if you have any questions. Let's see. So current projects that we are currently working on is, let me go back a little bit to technology during COVID. I kind of talked a little bit about how, we had to scramble going from everybody in person to technology. So we have our new WIC-wise technology, and part of that was we provided benefits with an e-card, with a debit card, which CalFresh food stamps had forever. We were kind of behind the 8 ball on that. It took us a while to get our ducks in a row. So perfect timing. 2019, February 2020, we got our e-WIC cards. Participants didn't have to do the paper checks. They could go to the store with a debit card, and we can mail it to them. Fantastic. The other thing that happened, and we had been already doing this for quite some time, we have a very strong texting program. We text our participants their appointments. Unless the participant doesn't want to be texted because they get charged, we'll do a telephone call. But we had texting system already in place, which is perfect. We also went to a new virtual platform called Doxy.me, and it's like Zoom, it's like Microsoft Teams, but it's more secure, and it was allowed by the state. And so we use the Doxy.me platform, and it's fantastic for doing counseling over. We were still able to use some Zoom. And so technology really took a while to get there, but we're flying now. So that was really important that we, went down that road. Current projects that we're working on, the governor gave us extra monies to do a Books for Kids grant. And so for every kid, we're providing education on reading to their child, and then we're also providing them a book. Also, what we did was we trained the staff, because part of literacy is not just reading, it's about talking to your child, singing to your child. And one of the things we did in the training is that we learned how to use puppets. And kids get really fun. And if you see a really quiet child and you bring out a puppet, it's amazing how much they will talk compared to without the puppet. So that's really fun. So we're currently doing that. We have been working with, one of the things with WIC is we have a very successful breastfeeding program. And we have over 180 breast pumps that we issue to moms that need it for various reasons. And so we have had a collaboration with Twin Cities to issue these pumps from moms who deliver. We also started that collaboration with Sierra Vista. And so we have pumps stationed at these hospitals that moms who need it don't have to come to WIC to get them. They can get them from the hospital, and then we monitor them. So that's a current project that we were working on. We also are having a new site in Paso Robles. I mentioned a little bit about that our current caseload for our agency is 3,800. 1,500 of those are in Paso Robles. And so we are moving to a new site that's going to be larger, and we're very excited about that. So we're working on that. Going back to participation for WIC, overall in California, we serve, it changes, but we serve around 960,000 in California. And our largest agency in California is, I don't know what it is right now. It might be around 250,000, and that's down in San Bernardino and Riverside. So our 3,800 is kind of small compared to that, but there's an agency up in up in Northern California that has 800 participants. So it ranges anywhere from 800 to up to 250,000, and that agency is our largest. So definitely a range. So we're very excited for our new site in Paso Robles. Can't wait for that. What's the best part of my job? Well, I will say that in our department, we have 14 staff members, including myself. And 13 of those are direct service, meaning they service the participants. I would say the best part of my job is, prior to this position I was in, was working with the participants. I love our participants. Pregnant women, babies, children, breastfeeding women. It's a great clientele to have because they're a pleasure to work with, and we are very proud to be able to serve them. The best part of my job right now is I like the climate that we're in. I like being in public health, and I think I mentioned that before. You'll know, and I'm assuming that being part of the public health club, that you guys already know that you love working with community. And I always tell people, if you're not engaged in it and you don't have a passion, you probably shouldn't be in it, and you have to be honest with yourself. So I really like that. The worst part of my job was probably dealing with COVID and just the uncertainties that we had, and just preparing for opening and closing. But we made it work. And I work with a great bunch of people who we all work together as a team. And so it made it easier. And I think I mentioned earlier, the best part of my job is that I know that people above me, great leadership, and they're there to help. So that was fantastic. Opportunities for members to volunteer or work. What I suggest is that depending on what part of public health, is that you kind of research on the websites about what part of public health you might want to volunteer for. I can be that, I can help that person get to the right person to see if they have any volunteer. For WIC, we currently have, so we work really closely with Poly. We have helped and assisted with many research projects at Poly. Dr. Ventura is someone that we worked with in the past, and with other research projects. Also, we have the dietetic interns from Cal Poly that go through our WIC program. And then also we work with the Atascadero State, and we also have their interns go through our program. I recently had a volunteer who was helping me, but there are a lot of things that you guys are busy with, especially when you get close to graduation. And so she wasn't able to stay very long. And there is volunteer opportunities within the public health department, but I can't really vouch for other departments. But I am certainly more than happy to help you get to where you need to go if you do want to volunteer at another department. So just let me know. At the beginning, I put my email address in there, so feel free to email me. We just had a position open up. It was for a public health aide. And then we have 2 retirements coming in June, and these positions that are coming up are going to be for registered dietitians. And one will be for a registered dietitian who is also certified as a breastfeeding expert, meaning certified as an IBCLC. And if you're ever wanting to know what jobs are available, and you probably already know this, is go onto the San Luis Obispo County website and look at all the availability. The job specifications are always on there. The job salary ranges are always on there. You just have to look those up. And if you're ever interested in being in the know for jobs that come up, fill out the interest card, and they'll email you when something pops up. And it's really helpful for future jobs. And I would like to feel free to chime in with any questions. I think one of the things that I would like to add is just things that are really important when you're going out to apply for any job. You know, I don't think it matters what job it is. It could be your professional job that you go to after you graduate, or it could be a current job you're in. One of the best, I forgot to mention this, but growing up here, everybody knows Frank's hot dogs, right? Everybody who grew up here, at one point in time, they worked for Frank's hot dogs, and I did too. And it was a great job. It was before I was a nutrition major, but to be quite honest, you know, I'm a very big proponent of everything in moderation. And so if you have a darn hot dog every now and then, that's okay. And so whether it be a job that you're working at Frank's, or whether it be a job that you're in your professional career or cleaning houses, you know, I think passion is important, but I think it's really important that you give it your all, and that you just put the work in, because employers can see when the work is not put in, and it's really important to put the work in, show that you're engaged. And maybe if you're not engaged in that position, then it needs to be something else. But be honest with yourself about what you really want to do, because as an employer and as someone who hires, and sometimes unfortunate, you know, people don't work out. But it's important to really be honest with yourself of what you want to do. You know, there's certain paths that you take. Like I took a path to be a registered dietitian. So there were certain things that I needed to do. I needed to get a degree in nutritional science. I needed to get accepted to an internship, and I needed to pass the test. So those were requirements. But after that, it was all about experience. And so get as much experience as you can, because that really, on your resume, that really stands out. Oh, look at all these things. We interviewed about a year ago for a registered dietitian position, and this one gal had so much varied experience. It had nothing to do with being a registered dietitian, but she had so much experience in she was a very interesting person. So another thing I'd like to say is that if you're going to get a job in California, after you graduate in your professional career and in public health, you might want to seriously consider really honing your skills in Spanish. I was really fortunate with working for WIC for 27 years. I learned on the job, and it was excellent because there's something to be said. Great, you take a class, but when you're working with it every day, you really learn it. And so really think about, especially in public health, because a lot of the jobs that I'll put out will be like the public health aide. It was required that they have Spanish. And other positions, we'll say Spanish preferred, but it's really important. And if you can go into a job and say, you know, this is what I've done, and I can speak it and I can communicate, that's fantastic. So I can't say that enough. And I say that specifically for people in California. You know, it just depends on where you live. You know, if you're over in Europe, then great. French, German, that will work. But French really doesn't pay off too well in California when you're working for public health. I mean, if you get what I'm saying. So that's just a little bit of information from me. I have droned on for forever now. What questions can I ask of you guys?
Oh, sorry. I have a question.
Yeah.
I was wondering how WIC conducts evaluations to see like how many people you guys are reaching and like how effective and like different strategies and stuff like that.
Yes, good question. So at the state level, we have the ability to do some reports by zip code. And so we can see by zip codes what areas need to be reached and what areas we have reached. And so we use that frequently. And then there's other ways that we kind of monitor. We have a huge outreach where we outreach to different entities like food bank, library, just all over the place we outreach. And so we want to make sure that we are serving and providing information for those people who may be eligible. And that's a great question, because I wanted to bring up that we service participants who typically are 185% under the poverty line. But there's also a lot of people out there who don't realize that they're eligible. For example, a lot of military families, and then a lot of working families. And so we kind of outreach to working families saying, hey, you might be eligible for WIC. So those are two areas that we really try to hone in on. When I worked for Santa Barbara County, Vandenberg was right there. So we had a large group of people who were receiving benefits from Vandenberg. We don't see it as much here, but it is available. And typically they are eligible for WIC. I will say 76% of our participants who have Medi-Cal, and typically people who have Medi-Cal are automatically eligible. So that's what we pretty much, if you have Medi-Cal, then you're eligible for WIC. If you also have food stamps, you typically are eligible for WIC. And I know that there's a large entity of Cal Poly students who have food stamps. And but again, you have to be in the category. Are you pregnant? You know, are you a prenatal participant? Are you breastfeeding postpartum? Are you a child? Are you an infant? So, and then you have to meet the category of besides income, but of address. You know, do you live in California? And so that's kind of, but great question. Thank you, Nadia.
I have a question
Yeah.
to ask. So when you transitioned to having more Zoom consultations or more just online work, do you feel as though a majority of the women that you are reaching out to were able to still access your services? Do you feel as though there were some people that were that you weren't able to reach who you wish you were able to?
Very good question. I actually think we were so lucky to go to the EWIC card, the debit card before. And because of that, we were able to reach pretty much anybody who was eligible. We were able to reach them, provide them the education via the phone, and then mail out their card. We even went so far as to have cards when they would show up in the parking lot, then we would have their card available to them right outside the door and they pick it up. So actually, I think we were able to reach, and they love it. They love, and that's part of the issue too, is trying to get them back into the site, you know, when we start seeing more of them. But I think it actually really helped that we were on the EWIC card and that we had texting and that we did it by phone. Now, some things got missed. And I will say this, the nutrition assessment part got missed because when we see there's certain appointments that participants come in for. And when we see the children 2 times a year or 1 time a year, we weigh and measure them and we take their hemoglobin, their blood iron level with a little machine that we have. Those are the things that got missed. And so when we were on the phone with them, we would say, did you have a doctor's appointment with your pediatrician? And we would try to have them fax those in or send it via email or text. So those nutrition assessment was very difficult to do over the phone. But as far as reaching them, I think actually that was better. Yeah, good question. Thank you. And I encourage you, if you get off this phone call today and you have questions later, feel free to email me and I can certainly help you out with any of your questions then.
I have another question. What does your budgeting look like? Like, do you have an Excel sheet where you like put stuff like a line item budget? We've learned just a lot about budgets recently, and a lot of public health practitioners talk about how it's like they hate doing it. So
yeah, going into this position a year ago, I think I had all the experience of other stuff except for the budget. And so I've learned a lot in the last year. And our budgets, it's interesting. I have Excel sheets that are county Excel sheets for county budget. And then I also have certain formats for state WIC. And so I'm kind of utilizing both. I'm all over the map, but it's formats that have been given to me that are required. And so, but I do have my own Excel sheets for different things that I utilize, but we have, yeah, that budget. It's almost like something you need to see in person to see what I have. And I'm, more than welcome to share that. But yeah, it's quite interesting. In fact, it's budget season for the county, and there's a lot of, we're just going into a new contract for WIC also, because our contracts for WIC are every 3 years. And so our last contract was 2019 to 2022. Now we're working on the one that goes from 2022 to 25. So it's a whole process in itself. Yeah. Yeah, I actually enjoy it. I always thought sometimes I should be an accountant because I like the numbers. Yeah. So good question. Well, I certainly appreciate the time and thank you for inviting me. Again, if there's no questions now, feel free to email me and just available for you. And that's part of what being in public health is. You're available to the community and to those who are in need. And we truly believe that when we're in public health. So I'm excited for you all. Just a real quick, is anyone graduating soon? Graduating in June? Yay, congratulations. Oh, Joseph, congratulations. That's fantastic. Yeah, that's exciting. Yeah, very exciting. So let me know if I can help in any way.
thank you.
You're very welcome.
Thank you so much. And thank you so much for this wonderful presentation.
You're welcome. I hope I was somewhat interesting.
Very interesting.
All right. Have a great day, you guys.